I'm Dr. Melinda Ring, Director of the Osher Center for Integrative Health at Northwestern University. And I'd like to welcome everyone to the IFAM Seminar Series event, the Osher Center Grand Rounds. So welcome to our online viewers. And just be aware that we don't monitor chat during the seminar, but do usually make time for questions and answers afterwards with the speaker. So please use the Q&A function and we'll do our best to answer them at the end as long as time permits. I'll just make another note that if this is the kind of topic that interests you or you know other people who would be interested, the Osher Center launched a podcast in the fall of 2024, and we're going to have a new season coming out too. It's called Next Level Health with Dr. Melinda Ring, and we will put the link in the chat. It's on Spotify and all these other places. And we encourage you to listen. We have great guests like Dr. Andrew Weil, Dr. Jeffrey Bland, Ben Fligler from the VA, all kinds of wonderful speakers. So please check that out. Now it is my great pleasure to introduce a longtime colleague and friend, Dr. Gurjeet Birdee. He is board certified in both internal medicine and pediatrics and associate professor in the Department of Physical Medicine and Rehabilitation at Vanderbilt University Medical Center. He received a Master's of Public Health from Harvard School of Public Health and completed the Integrative Medicine Research and Faculty Development Fellowship at Harvard's Osher Research Center. Dr. Birdee conducts integrative health and mind-body research. He's been funded by many different organizations, including the National Institute of Health, and he currently serves as the director of the Osher Center for Integrative Health at Vanderbilt. While there, he provides integrative medicine consults, yoga therapy, and continues to conduct groundbreaking research in integrative health. So it is my great pleasure to turn this over to Dr. Birdee.
Thank you, Melinda, for that introduction. I am just going to get my slides here for everybody to see. Like Melinda said, we're not going to be monitoring the chat, but I will try to leave time at the end for us to address any questions that you might have. So the topic I'm going to be talking about today is slow breathing. And, you know, just as a little bit of a background, I'm sort of really obsessed with slow breathing for a long time in my life because I found it as a technique as an adolescent, as a way to focus and as a way to relax. And what's so interesting to me about slow breathing and breathing in general as a therapeutic tool is that it's so universally available, that it is so commonly used, but we actually don't understand too much about what's going on with slow breathing, despite it being so readily available. And we don't know too much about what the specific clinical applications are. So today I'm going to share a little bit about the status of the science around slow breathing, particularly from yoga, and I'll explain why that's distinctive. And then a little bit about the clinical applications and where the future lies as it relates to this. Just some disclosures. I am the owner of two companies, Mind Body Evolution and LYP Enterprises. I won't be talking about any products or services related to those companies today. So to get down to definitions, I'm going to start with a yoga definition of slow breathing because it is useful. And it's yoga, which is, as you know, a practice from the South Asian subcontinent. A lot of it is described in Sanskrit, which is the equivalent of Latin in South Asia. And the term for slow breathing is actually called pranayama. And it dates more than 2,000 years in terms of a term related to breathing. And if we look at the etymology of the word pranayama, prana refers to breath. And, you know, breath and breathing, very much so in the physical sense, but also this idea that, you know, sort of the breath of life, right? Like if we don't breathe, it's what animates us. It's what gives us energy. And so not only is it in the very physical sense, it also means sort of like that idea that it's what energizes us, and it has that metaphor to it. The second part of the term is ayama, which means stretching or extending the breath. So the idea here in this term, pranayama, is that we are taking this vital aspect of human life and physiology, breath, and we're extending it. And by extending it, we mean we're making it slower. We are controlling it. There's a connotation there of restraint. And it doesn't mean restraint in that we're holding our breath, but what we're trying to do is regulate the breathing in a specific way, in space, that means physically, right? As we extend the breath, but also over time. So the practice of slow breathing in yoga refers to this idea of manipulating the breath, which is so vital moment to moment as we do things, and doing it in a way that's very regulated. And so here I am depicting for you in a graph what a slow breathing practice might look like in yoga. So here the y-axis shows you in the positive direction the length of an inhale, and in the negative direction the length of an exhale. And then on the x-axis is the breath number. So as you go through this practice, each oscillation refers to one breath. So in the beginning, if we were just breathing regularly, we're just breathing in and out, maybe a few seconds in and out. And then when you start practicing yoga, the practice of slow breathing, you start to increase your inhale, start to increase your exhale. And so if you look here, maybe on the 10th or 12th breath, what happens is we further lengthen the exhale. So the exhale, now you're breathing out maybe 7 seconds and you're inhaling 5. You do that for a couple breaths. And then we further increase the inhale. So now we're breathing in and out 6 times, or sorry, inhale 6, exhale 6. So you're looking at about 5 to 6 breaths a minute. And then there's a trend further where we further extend the exhale specifically in a traditional yoga practice. And so then now we are breathing in 6 and exhaling 12. And so as you can imagine, that breath is around 3 breaths a minute. And so it's significantly slowed down. You stay there and you do that breathing practice over a few minutes, and then you come back to more of a more shallow breath. And I like this because this just encapsulates, well, when I say a breathing practice or slow breathing practice, it depicts it. Basically, it is a progressive elongation of the breath with a certain ratio of inhale to exhale. And this ratio of inhale to exhale, of inhale 6, exhale 12, or a 1-to-2 ratio. And yoga is a classic ratio used for relaxation and stress reduction. So one of the ideas here, and this is thousands of years old, is that this specific breathing technique and these specific ratios have some specific clinical application, which is really interesting because from a research standpoint, we don't have that much data around that. So when we look at the objectives of what we're going to be talking about today, I'm interested in showing you some of the techniques and components related to slow breathing around yoga. And, these techniques are in other practices as well, but yoga is my main area of focus. We're going to talk about some of the potential mechanisms as to why slow breathing might have clinical effects and where the science is on that. And then we'll talk a little bit about the potential clinical applications, knowing that. So that being said, I want to present to you 2 cases. As Melinda said, in addition to research, I do see patients at our integrative center. I was practiced primary care for many years as well. But here in my current setting, I get referred a lot of patients for mind-body practices for health conditions. And so here's 2 examples of 2 clinical vignettes as it relates to that. 76-year-old woman who is retired nurse. She has chronic pain related to lumbar stenosis with frequent flares that really impairs her quality of life. So she has this chronic pain that makes it difficult for her to sleep. But in general, she's also really anxious as she goes to bed. And so when she wants to go to sleep, it takes hours to fall asleep. And if she wakes up at night, which could be due to pain or because of stress, she has interrupted sleep. This adds to a lot of fatigue during the day. And so it's impairing her quality of life. The second example of a case is a 42-year-old with anxiety disorder. She has generalized anxiety, so meaning that she's anxious often in many situations, in excess of whatever stressors that there are. And she also has panic attacks. So brief moments of feeling of dread, shortness of breath, and her heart is palpitating. She works for an hour. She works full time and commutes an hour and a half each way. And she has a very full life, as many of us do, attending to two children and married and just trying to fit everything in her life, which is so typical. Importantly, she does not want to take medications for her condition. So these are two very specific examples of patients who are referred to me to learn breathing techniques. And so today we're going to go through a little bit about the rationale of, well, what do I do? What is the science behind it as it applies to these two cases? And I'll share with you how these patients did. So one thing I want to note, some might say like slow breathing seems like a really focused topic, but I will propose to you that slow breathing and deep breathing is actually very common. In fact, if we look at complementary integrative therapies, and this is from the National Health Interview Survey, deep breathing is in fact the second most common, what we'd categorize as integrative treatment amongst treatments after you take into account natural products meaning dietary supplements, etc. And in fact, if we go further down on that list, if you look at yoga, Tai Chi, Qigong, and meditation, even perhaps progressive relaxation, there are strong breathing components to these treatments. So slow breathing in of itself is something that people clinically use. If we look at those like other mind-body practices, which are very common, it is also very commonly used. So for example, yoga, which is the most common mind-body practice in the United States, and this is back in 2012, over the last 12 years, we know the prevalence of yoga has increased even further. Training and for the yoga teachers who study or become certified in teaching yoga, learning slow breathing techniques is actually part of their standard curriculum, and they know how to do it, and they're teaching people to do this. So this is to say slow breathing is commonly used by people for their wellness. So how do we define slow breathing? So generally speaking, from a research standpoint, we define slow breathing as breathing less than 10 breaths a minute. And often there's a focus in the traditional Western science on 6 breaths a minute as a specific number. And as I already mentioned, it's very common in mind-body practices, but as you also know, psychologists use it in performance, like musicians, athletes will also use it. And lastly, it's even used in education. I recall my child, when they were in kindergarten years ago, came home and were showing me breathing techniques they learned in kindergarten for relaxation. So this is a very prevalent practice, and it's sort of dogma that slow breathing causes relaxation, which is very interesting from my perspective, because we're interested in the techniques, the quality, and the clinical effectiveness, and if you will, mechanisms behind these techniques that are so prevalent. So to break down the slow breathing rates a little bit further, I mentioned that breathing less than 10 breaths a minute is the common definition of slow breathing. And, from a yoga perspective, we have a little bit of a different perspective. So while breathing between 7 to 10 is a little bit slow, I mentioned that 6 breaths a minute is commonly taught. So a lot of your biofeedback devices are focused on 6 breaths a minute. But actually in yoga, we go much below 6 breaths a minute. In fact, most of the slow breathing techniques for most people, unless you have a respiratory condition or something, we're really looking at 4 or less breaths a minute. And that's commonly achieved. I do it clinically. We do it in our research studies, which is part of the technique that's specific to yoga that we're very interested in and that we've been researching. So as I've mentioned, there are many ways to learn slow breathing. I have mentioned that yoga is one of the techniques, and yoga is different than other tools that I'm going to describe in a second because it's self-guided. So in other words, that if you're going to do a breathing practice, it takes some self monitoring to reduce your breathing. And that's part and parcel of the yoga in terms of, and we'll talk a little bit about that when we come to potential mechanisms. But this idea that breathing might be self-guided, and many people do self-guided breathing. And then there's also device-guided slow breathing. So many biofeedback devices rely on breathing as a technique. And, I have HeartMath here as one, and Respirate is another. Respirate's actually an FDA-approved device that slows breathing down for people with the purported efforts of reducing blood pressure. It focuses on achieving a specific respiratory rate. We'll talk a little bit about clinical effectiveness, what the data is in terms of slow breathing and hypertension later. But biofeedback in general, you should know, does use this. If any of you on your wrist right now look down and there's an Apple Watch, I'm sure that you've seen the breath function there, and they're asking you to take deep breaths. That also, in my mind, is a biofeedback device. It is monitoring your respiratory rate and your heart rate. And in fact, it's measuring your stress, which we're going to talk a little bit about how it's doing that. And then when it sees that you're stressed and acutely, or you have an Oura ring, or you have Whoop, these are all biofeedback devices, same principles I'm describing. And then they guide people through, interestingly, breathing is one of the techniques as an intervention on your stress or your health. And then, of course, we have the last one, which is audio and visual guided breathing, which is externally guided, but not necessarily tied to biofeedback. And the best example is YouTube. YouTube is the most popular yoga teacher in the world right now by far and away. And so a lot of patients that I work with use YouTube as a way to learn mind-body techniques. So these are commonly defined techniques. But I want to really focus here a little bit on yoga, which is a little bit different because we go slower and it has some other components to it. So as I mentioned, yoga really is focusing on slow breathing, less than 6 breaths a minute. And so one of the things as it relates to that is, how do you achieve a breath less than 6 minutes but still be comfortable? And we're going to talk about that in a second. The other aspect of yoga breathing is that it's self-paced, so self-monitoring, as I mentioned. And then the breathing techniques interestingly used for yoga, the one I'm showing here on this graph, is actually specifically for relaxation. What is interesting, even though in my research, we're mostly focusing on these kind of techniques, there are actually a host of slow breathing techniques in yoga for other applications. This is just actually the therapeutic application of slow breathing of yoga. And so there are actually different techniques that create different states according to yoga practice and theory. So when we talk about slow breathing, there's a couple key components here technically. And I mentioned that, because yoga is going sub 6 breaths a minute, there are some technical aspects that I'll talk about. So if we're going to breathe, 2 to 4 times a minute, and we're breathing with specific ratios, right? Like I mentioned, a 1-to-2 ratio of inhale to exhale is purported to have more relaxation. There's sometimes people use holds or holds in the middle, so there's some variations there. But that first one in the bold with a 1-to-2 ratio is the one that's commonly used to achieve relaxation. And in fact, it's been around for a long time, thousands of years ago in texts, that slow breathing with this extended exhale increases relaxation. It is not just isolated to yoga. This idea of extending the exhale relative to inhale creates a more enhanced relaxation, is the premise of a lot of breathing practices that people will learn in terms of, or teach in terms of ratio, including psychologists. It's not the only one. There are other techniques such as box breathing, etc. So the interesting thing about yoga is that we're interested in bringing breath less than 6 breaths a minute, but not only that, it has to have certain qualities. And so the performance of how you're breathing slowly matters. And so one is, it needs to be comfortable. So we're trying to teach people to breathe that, but not be short, breathe that slowly, but not be short of breath. It should have a certain level of ease to it. And then there's the quality. In other words, you're not just breathing slowly, but you're breathing in a way that the breath is very steady and smooth. So these qualities are really important. And because of that, it requires a certain amount of attention to the breath. Because imagine a dancer who's dancing. They're not just doing the movements. There's a certain quality to the movement that we're trying to achieve. And so when we're having people do slow breathing, they actually have to focus to breathe with those qualities. Because we were interested in this, and self-efficacy is a really important measure for health behaviors, we even created a yoga self-efficacy scale that tries to assess someone's confidence that they are breathing with these qualities. Are they able to focus? Is it smooth? Is it comfortable? Do they not feel anxious more? And we use this as a proxy, one, to see what someone's confidence is, and also to have them self-report or rate their performance as they're doing breathing techniques. So when we get into breathing, all of you who, unless you've started doing some slow breathing just by talking or listening to me talk, you're doing involuntary quiet breathing. And so you know that when this happens, when you breathe out, it's relatively passive process, and it doesn't take much action to do that because the rib cage sort of contracts automatically as you exhale. That being said, inhale is a more active process. We're using some muscles in your rib cage. But when you're quietly breathing, it's not taking much effort. The diaphragm is facilitating this involuntary. So we are not thinking about breathing at any given moment. You're just doing it all the time, regularly. The diaphragm is contracting and relaxing, and you inhale and exhale. What's happening that's different in slow breathing techniques is we're adding some voluntary component to breathing. In other words, we're consciously changing the way that we breathe. And one of the main techniques that, you will hear the concept of diaphragmatic breathing, which means that you're actively drawing the belly inward when you exhale. Now, I have a little bit of criticism in terms of the term of diaphragmatic breathing, because in fact, when you're breathing out more completely, you're not just using your diaphragm muscles, you are actually also using your transverse abdominis, which is a muscle that wraps around your belly to exhale completely. So here on the right side of this picture, you see someone doing what's called an abdominal vacuum, where you draw your belly inward. This is an exaggeration, but it gives you the sense that when you exhale, and you're going to forcefully exhale, you're actually going to bring your belly inward a little bit. So it's not just the diaphragm. In fact, if you're going to take a deeper breath and slow it down, you're using this transverse abdominis. And then on the other hand, on the inhale, when we're doing yoga breathing, we're really actively using our chest wall to inhale. So this is actually more active use of our accessory muscles while we breathe in. And this is important because this is what allows us to take a big breath in and out when we're doing yoga breathing, which I'll show you why that matters in a little bit. The other aspect to yoga is we are using a technique to control the breath in our throat a little bit. It's called ujjayi, and it's a voluntary constriction of some of the muscles in your posterior pharynx. And we're going to all experience this. And what it does is it actually makes the breath slightly restricted and tangible. And you'll all experience that. What that means, but it's another way that we bring attention and focus when we're doing slow breathing techniques that allows you to stay focused on the technique. So these techniques that I just mentioned all come together to allow for a maximal breath in and out to an individual that is comfortable and steady. So the reason why I go through those techniques is so that, when people say, well, how are you breathing 4 times or less a minute but still comfortable? These are the techniques that allow that anatomically and psychologically, how we do that. Lastly, I want to just mention that all those techniques, what happens is because people have to use all these techniques, there's actually quite a bit of attention that is occurring in slow breathing techniques. In actual clinical practice, we vary the amount of attention that something requires depending on the individual. But it does require some continuous monitoring on the person's part. And because on any given day, someone might be feeling differently, their quality and attention of breathing actually varies. It's no different than exercise. Your exercise capacity may change from day to day. So when we're doing sort of looking at yoga breathing, right, there's stages of non-voluntary where we're just observing our breath, right? This is commonly used, by the way, in mindfulness techniques, this first stage of non-voluntary breathing. Then we enter a phase which is regulated slow breathing, which I'm going to take you through in a minute. And then lastly, there's non-voluntary back, which is meditation. And this is just to share with you that classically speaking, breathing techniques in yoga were used as a preparation for meditation. And I don't know the audience's interest in meditation. Many people do mindfulness maybe, or do quiet meditation. And this is just to say that traditionally, while yoga has therapeutic benefits in specific applications, it was actually used to prepare the mind and steady it so that people could sit for a prolonged period of time in meditation. So that being said, I'm going to take us through a quick experiential of slow breathing. And the caveat here is that usually when we teach slow breathing, it's a process of skills over time in a few weeks. And today we're just going to do a few minutes. So I invite all of you to close your eyes. And if you're sitting, try to be in the most comfortable position. Sometimes it's helpful to sit with a straight back, perhaps on the edge of your seat, if that's comfortable for you. And if you're comfortable, you can close your eyes. And then here in this position, bring your attention to your breath. Eyes closed if comfortable. Just become aware of your breath. Notice as you inhale, there is some movement, probably in your belly, maybe chest or both, but there's some expansion as you inhale. And then as you exhale, there's a natural fall of your belly or chest. Just observe your breath. You don't need to change it. And then notice if you take a bigger breath, you feel more expansion on your front side in your belly. Inhaling, feeling your belly expand more. And then as you exhale, notice your belly and chest falling. Bigger breath, belly expanding. And then as you exhale, try to exhale completely, emptying all the air out, even drawing your belly inward to get all that air out of your lungs. So practice this over a few breaths. If at any point you're short of breath, just take a break and stop. And you can resume if you're ready. Inhale, expand your belly. Exhale, draw your belly inward. We're going to add a piece here. As you exhale, you're going to make a gentle sound, whispering, almost like you're fogging a mirror. Just a soft whispering sound every exhale. You could be inhaling through your nose. If you can't through your nose, you can inhale through your mouth, either way. But exhale, making that gentle whispering sound. Inhale, belly expands. Exhale, belly goes inward, and make that gentle sound. As long as you're not short of breath, continue like this. Trying to take a full breath, but not be uncomfortable or short of breath. Finish the breath you're on and do one more. And then just let that pass. You can go back to breathing with no control. Just observe your breath. And you can open your eyes. This is online, so it's difficult for me to gauge people's experiences on what's going on. But, you know, everybody will have had a different experience. Maybe we have some Q&A if anybody wants to share anything about what their experience was. Doesn't matter, good or bad. But I wanted to take you through a brief practice of what breathing looks like based on the principles that we described. So then the question is, as we think about breathing, what is as a potential health intervention? Well, why? And breathing is really intertwined with multiple organ systems. It has various inputs and outputs. It's very interesting because when we don't think about it, we're doing it involuntarily, but we could take conscious control and voluntarily manipulate the breath. And it is exquisitely calibrated by our state constantly. And so here is a diagram of all the inputs and outputs that for the current theory of what regulates breathing. And you could see it is complex. There are so many physiological inputs into the brain that regulates breathing, that breathing cadence is set by a very primitive part of our nervous system in the midbrain. And it has outputs that affect so many things because it's regulated, it's got to be regulated and closely tied with activity, physiological state, waste, your cardiovascular system in general. So it is very sophisticated, balanced system. But we're going to focus on several of those pathways that might be relevant to slow breathing today as we think about the mechanisms of slow breathing, if you will, even what you just did, what could be some of the physiological mechanisms that lie underneath what you just did. So the most common area that's researched as it relates to breathing is autonomic tone, which totally makes sense because autonomic tone, as we know, is an involuntary system that's regulating our physiology constantly. I'm going to focus on cardiovascular physiology because that's where a lot of the research is. And the first thing to know is chemosensitivity, which totally makes sense in the sense that, our body is continuously changing our physiology to maximize oxygen delivery and remove CO2 in an unbelievably calibrated way, right? So you get up, you walk across the room, you start breathing more quickly. That is a physiological response to increased CO2 demand. Some of it's mental preparation, but your body is so good at monitoring that. And we know that inside your neck and in your aorta and the carotid bodies and aortic bodies, there are these detectors, these carotid bodies, aortic bodies that are detecting oxygen levels and hypercapnia. In other words, changes in CO2. And those get wired to the brain. And then as they're processed centrally, it changes the respiratory drive. So now when you start doing slow breathing, it's manipulating that breathing that's exquisitely monitored by your body, by your nervous system. And so in doing so, it's very interesting because there's some changes in some chronic disease and CO2 sensitivity. I just want to note, there's very interesting research to show that people with anxiety disorders have increased CO2 sensitivity, meaning that, they are more responsive to changes in CO2 in their breathing. And that these are tied to, as I mentioned, there's some brain target ways there in terms of amygdala activation that's changing their respiratory patterns. And so even if you look at respiratory patterns of people who are anxious chronically, they're breathing a little bit different. And that might be one of the triggers, not the only, of anxiety symptoms. And there might even be some adaptations that people are breathing differently, as I mentioned, with anxiety over time. And that relates to CO2 sensitivity. And so this is a very interesting pathway. I want to share with you that, there's been studies, this is by Bernardi, who's an Italian physiology researcher. This is an acute study where they look at the chemosensitivity. So in other words, what's the body's ability to tolerate changes in CO2 at different breathing frequencies. And here Bernardi was looking specifically in healthy subjects and showed that despite us decreasing, so there's two graphs there, or three lines there on both graphs, left and right. One is looking at oxygen saturation and end tidal CO2. And what they were looking for is, well, what's the efficiency of the body's ability to tolerate CO2 and get rid of CO2 when you start reducing? Because one might say that, oh, well, if you're slowing your respiratory rate down, wouldn't you be short of breath? This study demonstrates that despite breathing slowly, 6 breaths per minute, CO2 sensitivity actually remains unchanged. In other words, like the CO2, you don't have increased drive to breathe. You actually maintain a respiratory rate. And so it's actually in a resting state, if you use these breathing techniques, you can actually change your chemosensitivity. In other words, your tolerance to changes in CO2, which is very interesting. Another potential mechanism is baroreflex sensitivity. So, baroreceptors also in the carotid and aorta are very exquisitely detecting changes in blood pressure through transmural forces in the arterial wall, and changes like if your blood pressure is reduced, that stretch changes, and then your body sends neural pathways to the brain that are going to change your heart rate and blood pressure. And so this is also a potential mechanism for slow breathing. Another study done in normal and hypertensive subjects, where they took people who breathed 6 times a minute, and they compared it once again to people who are breathing spontaneously or with pace breathing at 15 breaths a minute, looking at blood pressure and baroreflex sensitivity. And what we see is that baroreflex sensitivity actually increases as you breathe slowly. So both of these studies, I should mention, the previous one and this one that I mentioned, are looking at acute changes, not chronic changes. But acutely so, your baroreflex sensitivity increases. Why this is relevant, it suggests that slow breathing might be altering our sensitivity to blood pressure. One of the things that's important in hypertension is a blunted baroreflex sensitivity. In other words, if your blood pressure is high, your neurological system had to be adjusted to tolerate a higher blood pressure because it's not lowering it. And so that baroreflex sensitivity is decreased in hypertensive patients. And one of the things that this study is demonstrating, that even in hypertensive patients, the y-axis demonstrating baroreflex sensitivity increases in hypertensive and control subjects. The last area that gets lots of attention is cardiovagal tone, which is basically the autonomic system's regulation of the heart rate and in general, the vagus nerve, the parasympathetic nervous system. Why this is clinically very focused on is because there's an association with decreased parasympathetic tone versus sympathetic tone for cardiovascular risk. And we also know that when people are in a stress state, increased fight or flight, if you will, there's an increased risk for many diseases associated with that. One thing to note is that, well, how do we measure this? And, we measure this in an autonomic lab, and we use various things to assess it. Though one of the most commonly used measures is heart rate variability. And, even your Apple Watch that you have on your wrist is using heart rate variability. Now, how good of a measure that is for heart rate variability as a stress or a surrogate measure of stress is questionable. But that being said, this is an area that's used to look at the effects of slow breathing a lot because it's so accessible. And when we look at slow breathing, this is once again an acute study. It shows that when you correct for respiratory rate, which you have to do when you're doing slow breathing, there is an increase in sympathetic tone. And so that's what this graph shows, or this table shows here on the right side. LF, which is low frequencies, heart rate variability, a spectral analysis, is really a surrogate measure of sympathetic tone. HF is parasympathetic tone. And what you see is there is a decrease in sympathetic tone during slow breathing from 129 to 100 versus an increase in parasympathetic tone during slow breathing. So there is this idea acutely that there is an increase in vagal tone when you're doing slow breathing techniques, and that might have some benefit for individuals cardiovascularly. So those are the common theoretical mechanisms for slow breathing in from a physiological standpoint. There are others, but those are most common, which is the chemosensitivity, baroreflex, and heart rate variability. But there's also the psychological techniques. And, one of the most important things when I mention slow breathing is that it's capturing someone's attention, right? So there's features to that that are really important. I already mentioned that when we are teaching someone breathing, we want them to focus. And in part, even when you do this practice, some of the language is about being comfortable breathing out completely and smooth and making sure you're okay. And then we use another psychological principle of dual tasking. Now, we didn't use all of them for the techniques I showed you today, but dual tasking is this idea where you have to attend to 2 things at once, and this increases the cognitive load, if you will, and helps people focus or requires them to focus. Some of that might be counting their breath. Some of it might be physical coordination, as you all did, as I say, inhale, expand, exhale, draw in completely. And then, of course, paying attention to the quality is also has a component of that. So that being said, I already talked about this idea of self-monitoring of breathing and the quality. This is important, not just for the quality, but also we're teaching people a health behavior with breathing. And from a psychological perspective, one of the things that we might be doing is as people learned a technique that is of self-regulation, it actually is increasing their confidence that they can control their health. And from a lot of research in psychology, we know that any behavior that someone does that they gain and they experience an increase in their ability to control their health has actually an outcome on various health behaviors, that sort of increased locus of control. So another potential mechanism of slow breathing is it's a health behavior that's increasing self-efficacy. And then if you're learning slow breathing from someone, there's also the aspect of a therapeutic relationship with someone. You might have expectation. So there are, to say, many potential mechanisms of how slow breathing might be working. And here's just like a working graph of some working figure of how they might work. I mentioned the psychological ones, which is a change in attention, increasing self-efficacy. I'm going to talk a little bit about negative affect when we talk about clinical applications. And then, of course, there's physiological mechanisms. And it's very likely that slow breathing, as with many interventions, has potentially many different mechanisms that are at play, depending on the applications. So coming back to our clinical vignettes, after summarizing some of the potential mechanisms, the 76-year-old woman, I gave her a breathing practice, very similar to the one that I showed graphically. And what happened was she was able to fall asleep. And it's very common that when we teach people breathing techniques at night, they fall asleep as they're doing the breathing techniques. And over time, she was able to come off her zolpidem, her Ambien, which you know is a high-risk medication for elderly patients. And so she was able to come off of that and sleep better. For the 43-year-old, finding time to practice was very difficult for slow breathing. She was feeling really anxious. What we found was the best time for her to do slow breathing techniques was in her car after her commute or from work to home before going in or before she starts driving, to do a short 10-minute breathing practice. And she was able to reduce her anxiety using these breathing techniques on a regular basis and had reduction in symptoms. So two very different applications to some degree, because one is more for sleep and secondarily pain. The third one's just purely anxiety. So that comes to the clinical applications of slow breathing. I'm not going to do a comprehensive review of the clinical applications in this talk because it's not enough time, but I want to impress upon you that many stress-related conditions, slow breathing can be related. And we already talked about, if you remember, in terms of physiological changes, a lot of those are looking at changes in physiological stress, if you will, through autonomic tone. Secondarily, there's psychological benefits of reduced perceived stress, as with the retired nurse. So I'm going to focus on anxiety and hypertension, which are two areas of research. There is also data looking at depression, heart failure, people who are looking at pain, respiratory conditions, and then there is some research among populations with diabetes and obesity as a tool for behavioral modification. But by far the most data is in anxiety and in hypertension, especially as it relates to slow breathing alone. So here is a meta-analysis of the effects of slow breathing on anxiety and as compared to active controls. And what it shows is that if you compile the data together, it looks like there's a benefit of slow breathing techniques. Our challenges in this field of research include people specifically describing the breathing techniques, how they're doing it. The other question is, what is the frequency that people are doing it? How do we monitor if they're doing it? And if they are doing it, how slow are they breathing? And what's, how adherent are they to the techniques? Another challenge is that most of the people who've researched slow breathing haven't brought breathing rates down to less than 6 breaths a minute. There's some research, but few. From a yoga perspective, we really don't consider, as I mentioned before, breathing slower, like 6 or higher, as that slow or being that clinically effective. So, that's an area that needs work. And then, of course, having adequate comparison groups, which is always a challenge with any clinical trials. So we did some research related to yoga-based slow breathing, specifically to answer this foundational question of, does slow breathing reduce psychological and physiological relaxation? And also this principle of, does extending the exhale make a difference? And so this was a study funded by NIH that we looked at specifically those questions. We did a 12-week randomized trial amongst 99 healthy adults. And what we did in this study is we compared just two breathing ratios, exhale greater than inhale versus exhale equals inhale. And it was taught one-on-one by a yoga therapist. And we measured outcomes throughout the study, but our primary outcomes were changes from baseline to 12 weeks. One thing that you might notice from the study design is we actually didn't have a comparison group, because when we did the study and the funding mechanism, we were really looking at differential breathing techniques. So that does limit our conclusions, you'll see as we get through. We measured stress through PROMIS anxiety, a common measure used to measure anxiety. This patient-reported outcome, the mean, as you know, the mean on PROMIS measures, you may or may not know, the general, it's anchored where 50 is average in the general population, with plus or minus 10 being a standard deviation. So if you have a higher PROMIS score, it means increased anxiety. Just as a benchmark, if you have 62 or higher, it's very likely you have a clinical diagnosis of an anxiety disorder. And then for physiological measures, we use vagal tone measured by high frequency heart rate variability. We did measure other measures of autonomic tone in our lab as well, but this was our primary outcome, which, as I mentioned, is a surrogate measure of parasympathetic tone or relaxation. So we have a self-reported stress measure and a physiological stress measure, if you will. I'm not going to go too much into the details of how the protocol was delivered, but we actually screen people ahead of time to see if they're going to be adherent to the treatment intervention. And then they come in on a weekly basis once they demonstrate that they can do it. And then people are randomized to those two different breath ratios, as I mentioned. In this study, we enrolled and randomized 99 patients, and we used, in the end, 97 patients for an intention to treat analysis with pretty good outcome assessments. We had great adherence. So, out of the 12 sessions, the mean class attendance, which was one-on-one, was almost 11. And people practiced a lot. People practiced on average 5 times a week, which is important because, one, that's a very good dose of slow breathing, I feel like. But two, it also suggests that this is a technique that people might actually do, which is very hard. This is just an example of a graph of an individual where you could see their heart rate when they're doing the practice and slow breathing at the top. And then the bottom, there's a blue line that's showing their minute ventilation, which stays, reduces along with their breath rate, which would be expected as they do the slow breathing. Just to note, this just lets me share with you that, we did remote monitoring of the breathing. So we use biometric devices, vests, to measure people practicing at home. And so these two graphs show that we're able to look at the inhale and exhale ratio as people practice remotely. This is one of the things I like about breathing as a research topic, because we can actually be pretty precise with these kind of tools to see if someone breathed and what their fidelity was to breathing. So a majority of people who had a different inhale to exhale ratio, we know that they achieved that. We know that most of the people who had exhale equals inhale achieved that. And we have very good certainty in terms of people reaching the targeted decreased respiratory rate. In terms of outcomes and measures, just quickly, so we saw a reduction in PROMIS anxiety, even though this was a healthy population. Their baseline PROMIS anxiety is 56, which qualifies as mild stress, and we see a significant decrease in PROMIS anxiety. We saw really no significant signal in vagal tone here in this study, which is of note in these patients. Now, both of these changes in context, you have to know that we're looking at before and after. We don't have a comparison group, which does limit generalizability of the conclusions. But here you could just see breath ratios here. So the blue is an equal inhale to exhale ratio. The red is an extended exhale. And while not significant, there's no significant differences. There is this decrease further in anxiety as people extended their exhale. And when we analyze looking at baseline anxiety, right? So if people are more stressed at the beginning of the study, we see that the difference between inhale to exhale, like as someone extends their exhale, those two groups, the difference is further. In other words, people who extended their exhale, if they had more stress in the beginning, there does seem to be a further response and reduction in anxiety, though we'd really need a comparison group and a more anxious population to really identify that. More globally, people's mood gets better doing slow breathing. So we use PANIS as a measure of affect. And what we see is that slow breathing reduces negative affect, and positive affect is increased as well. This is very consistent with other research showing that generally, globally, slow breathing techniques have a positive effect on mood. So one would then, to extend this idea of sort of stress in this study and others, of if there's improvements or reductions in stress in the mind, is there any correlation with the physiological stress measures? And I already told you that there wasn't a significant change in physiological stress, but this is just to highlight, we really see no correlation between physiological and psychological stress. There's various reasons for this. We're not the only ones to report these findings, but it may be that heart rate variability is just not the best measure of physiological stress. And these are changes that occur over time. But even if we just look at cross-sectional data, looking at anxiety and heart rate variability, unfortunately, this does bring into question some of the value of the Apple Watch and some of this technology that's using heart rate variability to report people's stress. But what we can say is that generally speaking, slow breathing that was associated with reduced stress. We don't know if different ratios really make a difference. We need to do further research. It brings some question into what the value of heart rate variability is as a measure of physiological stress. And we're really just not seeing any correlations. We're going to, I want to leave at least 5 minutes for questions. So I'm just going to briefly go over some data on blood pressure, because we did track looking at the effects of blood pressure on slow breathing. And the slow breathing groups, there was no comparison, but we do see a decrease in systolic and diastolic blood pressure in the population. And this is consistent with other slow breathing studies that are looking at device-guided and non-device-guided slow breathing, that there is some benefit to slow breathing. However, if we look at the quality of these studies and the heterogeneity of the interventions and taking into account the control groups, it's hard to say convincingly that slow breathing techniques reduce blood pressure, even though it's something we've observed in other studies yet. So, I think we're confident that acutely slow breathing lowers blood pressure, but really long-term, we don't know. The other interesting thing of blood pressure is that, as I talked about those mechanisms, we're really not sure about how slow breathing is affecting blood pressure. And one of the important things to note is that the data for hypertension and its correlation with psychological stress is very poor. In other words, generally, essential hypertension is not affected by stress, even though it's a common notion that if you're stressed, your blood pressure is high, but not for essential hypertension, if you will. We don't think it's a primary factor. So why slow breathing is particularly of interest for me as it relates to looking at effects on blood pressure is that if it's not occurring through psychological mechanisms, if it does in fact have a effect on blood pressure, I feel like it can help elucidate how slow breathing is having an impact on human physiology. So where we are, we know from our own research that, we have very high adherence to an intervention, and that there's some associations with reduced stress and blood pressure, but really no changes in associations with heart rate variability. So we're trying to further these studies, looking at clinical populations with anxiety disorders and hypertension populations to answer. In fact, we're working on a grant. My co-investigators there at Northwestern, David Victorson, and we're preparing a grant to look specifically at anxiety disorders and slow breathing as it relates to that. We're trying to improve the comparison groups as compared to prior research and our lack of one by using relaxing treatments that don't affect breathing. And we're going beyond autonomic tone because we're just not seeing that much signal in looking at mechanisms of how slow breathing is working. Some of that's looking at changes in respiration, sleep, neuroendocrine and inflammatory pathways. So just to summarize, this was the intervention that I described before. I described some of the cognitive and physical techniques related to slow breathing that achieves a comfortable yet focused slow respiratory rate. I wanted to describe some of the physiological and psychological pathways for you around slow breathing. That I wanted to describe where we are in terms of the evidence of slow breathing, which is really, despite it being prevalent, I don't think we really have specificity in terms of clinical applications. And so more research is needed, not only for the mechanisms, but clinical application. And yet, for me, slow breathing is so accessible and generalizable. There's so many yoga teachers out there that are well-equipped and psychologists that teach slow breathing. I just feel like it's a field that needs a little bit more research so that we can advance its clinical applications. So that leaves us some time for questions.
Great. Thank you so much. Thank you, Gurjeet, for that whirlwind tour. So we have three questions, so we'll see if we can make it through them. The first one is related to something that I noticed in that meta-analysis that you shared, which was that 3 of the studies that were at the bottom actually favor the control over slow breathing. And so this person asked, I'm used to breathing with my chest due to anxiety, which only makes my anxiety worse in a never-ending cycle. When I try to breathe with my belly, like in this exercise, it almost feels as if my muscles are so out of shape that it's quite impossible, like a balloon that's too tight to inflate. So what do you recommend for that, and how can I fix my breathing pattern to ease my
Yeah,
anxiety?
it's a great question. So one, working with someone who knows how to use breath is going to be the first tool, because there's going to be ways for you to use your belly in a way that you haven't. It's interesting that a lot of our physical habits about breathing are deeply entrained. And so if we just want to do them, it won't work. But there are ways. So for example, to the person who asked the question, doing a forward bend, as you breathe out, your belly is going to go inward. And it's a way for you to learn how to relax your belly as you breathe out, because you cannot inflate your belly when you bend forward, I assure you. So that is like one example of working with someone who would teach you, we can do it in physical movements, and then you can approximate that when you're sitting still. The second thing I want to say is there are some people whose slow breathing techniques are not appropriate. So if you have a lot of chest discomfort or anxiety when you focus on your breath, or you have panic disorders, or you've had chest trauma, I've had patients who've been in motor vehicle accidents, bringing attention to the breath is not appropriate, and it actually increases anxiety. And that's a clinical contraindication to using breathing as a technique. Great question.
Thank you. Okay. Oh, now we got 5 questions. Okay. So thoughts about the opposite of slow breathing, like the Wim Hof style breathing, where one sort of hyperventilates, quick breathing, followed by the complete exhale and breath hold. So any thoughts on that in terms of
Yeah, so,
therapeutic?
right, there's less research on it, right? Even in yoga, there are techniques that use rapid breathing. The reason why I don't research those techniques is, one, for some people, they can have side effects. I see the less of side effects with slow breathing. Generally speaking, we're looking at breathing as a relaxation technique, which is associated with slow breathing. The rapid breathing is sort of used for different purposes in terms of yoga. Does the Wim Hof method have some data? Some, but I'm less convinced. Clinically, I do not use it for therapeutic purposes.
Thank you. Uh, okay. What, if any, serum biomarkers are you looking at for the mechanism of action of slow breathing? Is there any utility in other things like functional MRI? I know you mentioned heart rate variability as one. I saw you mention CO2, uh, tidal volumes, et cetera, as others. So any serum biomarkers, any use of things like functional MRI?
Yeah, so definitely there's hopefully the use of functional MRI. There are some people who using, probably functional MRI and meditation research and yoga research. There's been little to look at breathing specifically. So it'd be great to replicate some of the studies for the fMRI. For biomarkers, there's a large array of things. We've looked at looking at catecholamines in the blood. So like looking at norepinephrine, epinephrine, et cetera. And we see some signals there, but we really don't know. There would probably be some value in measuring cortisol as it relates, and there hasn't been much research looking at particularly diurnal cortisol measures as a measure of stress. So I think there's opportunities there. As it relates to blood pressure, there's a lot of interest looking at inflammation and biomarkers of inflammation, and we're interested in implementing that as it relates to hypertension specifically. So to answer your question, yes, there are other biomarkers we're looking at. Probably the inflammatory cascade is the most interesting as it relates to hypertension. To be honest with you, the mechanism that I'm most interested in for stress is actually looking at changes in people's respiratory patterns more chronically, because I actually think that the CO2 levels may be a major mechanism of action of slow breathing. But that's not a serum biomarker. That's a great question, Mark.
Okay. You okay staying on for, we'll just finish
I'm
off these
good.
last two.
Yeah,
Okay.
sure.
What's been your most effective strategy? This is kind of like a two-part question, to gain buy-in from patients to engage in it, and then funders to fund it.
Well, if I knew the latter, then I would be a
Yeah.
very happy person. And my argument for funders is that I actually do believe that this is a highly accessible behavioral treatment. I think, everybody has the capacity to regulate their breathing. And if we could just figure out a way to prove that it works and a way to implement it, I think we can get, get it studied. There is interest in breathing in research. If you just look at the amount of research studies related to breathing right now, there's sort of a new wave in the last 5 years of people doing research in slow breathing. So I think we're going to get there, hopefully, and hopefully the funders will back us up. For patients, it's pretty easy, Emily, to get buy-in, because as with many things, which I love about my field, is I can just take people through a 10-minute practice and they experientially see the effect. The downside is low, right? Like, it's slow breathing techniques, generally low risk. So the buy-in for patients is to give them an experience of slow breathing. And as long as they find it positive, then they've bought in. And so I find experience of a technique is the best buy-in strategy.
And can I ask, just to that point, now you are a physician who also is a yoga therapist and breath specialist, so you can bill your time, I think, for patients to have this training with you. Yoga therapists as a whole, as a field, are not generally covered yet, although I think there's a code at the VA for them. I know some physical therapists may include it, but may not have the expertise, other than, say, a physician or maybe a psychologist who's done mind body type things. How is coverage for this, or is it really just an out of pocket? Go find
Yeah.
a well qualified yoga therapist, but it's going to be an
Yeah.
out of pocket expense.
Yeah, it's going to be an out-of-pocket expense.
Yeah.
But what's interesting is that the techniques that I'm describing are actually commonly taught in a 200-hour yoga teacher training course.
Okay.
The basics. Now, do they know the specific clinical applications? No. But the answer is yes, Melinda. It's out of pocket,
Okay.
unfortunately. But it really is amazing to me, how commonly used breathing techniques are. And I think there is a way to make it cheap and accessible. And as I mentioned, the risks are so low. I think it's worth considering retail options. Many patients would rather, I think, and obviously you made a good point that I bill, but there was a time when I was doing primary care that 25% of my patients were patients just coming to treat non-pharmacological treatments for anxiety. I mean, this was just, and most of its breathing techniques is what I'm offering. And so
Mhm.
I think there's a huge potential benefit to reduce medication burden using these techniques, which there might be some
Absolutely.
cost savings for in the long run.
And then the last question is, and I think you touched on this, could there be a placebo effect if they think it will relax them? Maybe it does. I know you mentioned that in terms of there's the therapeutic relationship that could play a role. There's the expectation that could play a role. Um, any thoughts? I mean,
Sure,
from the
no,
data you're showing, it sounds
yeah.
like, no, there's something real happening there.
You
But
know, and I think that's what's interesting is from doing a well-controlled randomized clinical trial, we know there's going to be an expectation, a placebo effect. The question is really what in addition is happening with slow breathing, if anything, and that's why we want to do research to see if there's added benefit. And so there is clearly a placebo component to this treatment. There's also a complete placebo component to just about everything we do in
Right.
medicine. Not everything. There are some things I could say, like biologics and rheumatoid arthritis probably are mostly, but real. But there are going to be a lot of treatments that have this, and we just need to differentiate. Acupuncture is a great example. We think 50% of acupuncture's benefits might be placebo, but then there's something else happening. So it's a great question. We got to sort through it.
Okay, great. Well, we are over time. Any last closing thoughts? Otherwise, we'll all just take a deep breath and
Yeah, just I'll take a couple big deep breaths. And if you have any questions or thoughts for me, feel free to reach out to me. I'm happy to put my contact in the chat.
thank you. And look forward to seeing the results of the work you're doing in collaboration with Northwestern too.
Yeah,
We'll
we look
love to
forward
have
to it.
your team back for that update.
Yes, great. Thank
All
you.
right, thanks.
Bye.
Thank you, everyone. We'll see you next time.